just imagine two similar people that walk into their doctor's surgery on the same Monday morning, roughly the same body, the same age, both with a knee that is painful on the stairs. And if you scan them, the pictures would look identical. Just imagine that scenario. One of them is in pain most days of the week. The other person just notices it on a bad day and forgets about it by lunchtime. So one has pain that is debilitating, the sort of pain that decides, what they do at the weekend, and the other person just manages with the pain. They are just a bit troubled now and again, and then, that pain can be dealt with. And the thing is, the difference between them very often has nothing to do with the cartilage or the joint itself. It is happening in their blood, in the fat around their organs, and what has been going on their plate for the last 20 years. Now, before we go any further, let me just be really, really clear. You cannot eat your way out of arthritis, and no breakfast is going to grow you a new layer of cartilage. But now you're here, I'm going to take you through what's really going on inside a painful joint, because the pain that you feel and the damage on the scan or the X-ray are two completely different things, and the gap between them is where the food does its work. And this is the stuff that your doctor, let's be honest, probably didn't have time to tell you in a 10-minute appointment or didn't really understand in the first place. So, today we're going to cover 5 different things. Why acute and chronic joint pain are different conversations. So acute means very short term and chronic means long term. The second thing is what inflammation is doing inside the joint. The third one is why the fat around your middle behaves like an organ that is shouting at your knees. Number 4 is which foods turn that shouting up and which of them turn it down. And then finally, a few trials that put real numbers on it. And as always, I will put the links to these studies in the description below. If you're new here, then hello. Thank you for clicking on this video. My name is Dr. Alex. I work in emergency medicine here in the UK, and I make these videos because I've spent this last decade treating diseases that we could have prevented decades earlier. And if that sounds useful to you, then a like and a subscribe and a hype as well. It really does help more than you'd think. And all of those are completely free. Right. So the first thing, and this is the part that people often skip over, is that joint pain isn't just one thing, and the wrong assumption here can be pretty dangerous. Acute pain is the sudden stuff, like in one joint, often hot and swollen, coming on over hours rather than weeks or months. And some of those causes really do need a doctor today rather than a diet plan. And what I would say is if you're concerned and it's really, really painful or you feel unwell, then just go straight to A&E. A&E doctors are great at managing this sort of acute pain because quite often it can be pretty serious. Now, septic arthritis is probably the most concerning one, and this is simply an infection inside the joint. This can absolutely wreck your knee in days, and it can be in certain circumstances, it could be fatal if it's not treated. That can turn into sepsis, and it can just become an overwhelming infection. I don't want to scare you here, but it can be really, really serious. That's why I always say, go and get it checked out. And I've seen plenty of these come through the emergency department over the years. It's usually one swollen joint, that somebody can barely move. And they are normally feverish, looking quite unwell. If you're concerned about this, just get a doctor to see it today. That's what I'll say here. And then we've got gout and pseudo-gout. These are what we call crystal problems, which sounds fancy. Basically, what it means is that crystals can form inside your joints, and it can be really, really, really painful, and that can mimic septic arthritis. And then we've got trauma, so falls or injuries or accidents and fractures or broken joints as well. And then we've got pains that turn out to be the first sign of something else entirely. So basically what I'm saying here, quite long-windedly, is if your pain is new and severe, if it's one hot swollen joint, if you're feverish with it, if you've lost weight without trying, or it wakes you every single night, that is a same-day conversation with a doctor. And the easiest way to get that is by going to the emergency department. What we're talking about in this video is the opposite end of the spectrum. It is the chronic stuff, the knee that has ached for 2 years and the hands that are stiff in the morning, the diagnoses like osteoarthritis and rheumatoid arthritis. And nearly all of those, including the ones we used to call wear and tear, have inflammation running underneath them. Now think of your immune system as a repair crew. So when you cut your finger or you get a bite in the garden, like an insect bite or a spider bite, that repair crew turns up. The area goes a bit red and hot and swollen and a bit sore. they clear out the damage, they rebuild, and then they pack up and they go home. Now, you've watched that last part happen, I'm sure. Most people would have had some sort of short-term inflammation because the redness around a cut or bite settles over a few days, and it's typically gone within a week, isn't it? That is healthy inflammation, and you would be dead without it. That is our immune system working to keep us alive. But chronic inflammation is a different animal entirely. Rather than a short, intense response in just one spot, this is your immune system sitting overactive at a really low level for months and years everywhere, from once across your entire body, because those signals travel in the blood to every single tissue that you've got. And that is the version that drives disease in your arteries, in your liver and your joints as well. And when that happens inside a joint, it means the synovium, which is that thin lining that makes the synovial fluid that your joint actually sort of like glides in, that gets irritated and thickened, and it starts pumping out molecules like TNF-alpha and interleukin-6. Those do two jobs, and both of them hurt you. Those are things that you do not want. The first one is that they switch on enzymes that chew through cartilage faster than you can rebuild it, and they turn up the sensitivity of the pain nerves supplying the joint. So the same damage produces far more pain. That is why the scan and the symptoms, like the ultrasound scan or the X-ray, and your pain level, come apart so often. And unlike the cartilage, the signaling is something that you have real influence over. Now, the third thing is where a lot of that inflammation actually comes from. And the honest answer is body fat, specifically visceral fat, which is that deeper fat packed around your liver and your intestines rather than the superficial fat that you can pinch under your skin. Now, we used to treat that fat as almost like a passive storage cupboard. This is what we thought it was. And that is simply wrong these days. We know a lot more about visceral fat now. It behaves a lot more like a gland. And as those cells get overstuffed, they become stressed. Immune cells called macrophages move in among them, and the tissue starts releasing the same messengers straight into your bloodstream. Now, your knee doesn't know where that inflammatory signal came from. It just receives it year after year. As I said, very often from your visceral fat. And the clue that, pain in the knee isn't just a load problem like a weight-bearing problem is what happens in hands, because carrying extra weight raises your risk of osteoarthritis in your hands as well. And your hands do not carry you anywhere. They don't carry any load like your knee does. So when a doctor says that losing weight would help your knee, they're usually thinking about load and the actual weight going through your knee. And obviously that does matter, but the chemistry, specifically inflammation coming from the fat that you store, that is doing at least as much damage as the physics. Now, moving on to the food itself, and I want to describe this as a pattern rather than just a naughty music list, because no single meal is going to be the villain here. Just picture a very ordinary British day. White toast and jam in the morning, refined carbohydrates. A coffee and a biscuit or a cereal bar mid-morning, more refined carbohydrates. A meal deal sandwich from Tesco with a chocolate bar and some crisp, which is more refined carbohydrates. And then a pizza or a ready meal or something like that in the evening, very often containing more refined carbohydrates. Now, the thing is, nothing about that diet is unusual to the average person in the UK or the US. But here's what it does biologically. Each refined carbohydrate hit sends your blood sugar and insulin up really sharply, and repeated spikes drive the production of what we call advanced glycation end products, AGs, which are basically sugar molecules that stick to proteins in your body where they shouldn't, and then stiffen your tissues as well, including the collagen that your cartilage is made from. That diet is also really low in fiber. And your gut bacteria, they actually live and survive on the fiber that you eat. They produce short-chain fatty acids like butyrate that feed your gut lining and also calm your immune system down. So if you starve your gut bacteria by eating very little fiber, then your gut lining will get leakier. Bacterial fragments then cross into your blood, and the immune system sits on sort of like low alert permanently. This is what drives a lot of the low-grade inflammation. Now, when you eat an anti-inflammatory diet, basically the Mediterranean-style way of eating, it doesn't take a lot to get these inflammatory foods into you. It's vegetables and pulses. It's oily fish a couple of times a week, which we do with sardines and mackerel because they are cheap. They don't need any cooking. It's also extra virgin olive oil, and it's nuts and seeds as well. Basically, basically just whole good natural foods that are really easy to find. None of this is exotic. So let's talk about the evidence behind all of this then. The strongest piece of evidence is a trial called IDEA, IDEA, published in JAMA in 2013, and as always there's a link below if you want to check that out. They took 454 older adults who were overweight or obese with painful knee osteoarthritis, and they split them at random into 3 groups for 18 months. Diet alone, exercise alone, or both of them together. Now, the combined group lost roughly 1/10 of their body weight and came out with far less pain and also better function and faster walking speed and lower force through the knee. And more importantly, actually, for what we've just discussed, lower interleukin-6 in the blood, which is the inflammatory cytokines. So in people who already had established osteoarthritis, changing what they ate and how they moved brought the inflammatory chemistry down and brought their pain down with it without anybody regrowing any cartilage. That is the whole argument of this video measured in a proper randomized trial. In rheumatoid arthritis, there is a Swedish randomized trial that put 51 people on either a Mediterranean-style diet or their usual food for 12 weeks. And the disease activity and pain fell in the Mediterranean group. No surprise there. There's also a trial in The Lancet from 1991. So, yeah, a good number of years ago. But they used fasting followed by a plant-based diet. And again, they saw similar findings. And it's also worth mentioning here that what the evidence says is that supplements don't really help joint pain, and they are obviously nowhere near as powerful as diet and exercise. In my opinion, if you've got joint pain, a capsule isn't going to fix it unless it is a prescribed medication like an anti-inflammatory or a biologic. But, there is plenty of evidence that changing what you eat can actually help your symptoms. Now, let me just preempt a couple of things that I know people are going to mention in the comments. The first one is that, everybody knows somebody who ate terribly into their 90s and they had perfect joints. And that is fair because genetics, old injuries and luck, all of this play a part here. And none of this is a guarantee for any one person, obviously. The second is that it's all just aging, which doesn't hold up when you compare the same age groups across different populations. And I want to be clear here that food is obviously only one piece of a much bigger pie here. Diet on its own, without strength, work to build the muscle that acts as your joint's shock absorber, without sleep, without dealing with stress, all of this will underdeliver every time. And the double whammy of a modern diet plus a sedentary life does far more harm than either one alone. So here is the order that I would work through if you've got joint pain. You need to get properly examined first so that the serious causes are excluded and you have a diagnosis rather than just guessing. You want to take the treatment that your doctor recommends and never stop a prescribed medication because of something you watched online, my video included, because it may be anti-inflammatories that they are prescribing you or biologics if you've got a, autoimmune condition. All of those are going to really help you in the short term. And then, whatever your label or diagnosis, you want to work on the inflammatory background underneath your diagnosis because it's shared across nearly all of the potential causes of joint pain. And the hope is that once things improve, you can gradually wean down your medication under supervision because the work that you've done underneath is so powerful. So you want to change your eating pattern rather than adding a supplement in. You want to do strength training twice a week and daily walking as well. Both of those will help your joint. But if it's really, really painful, then just get some advice from your doctor first. And then what I would say, in most cases, you want to track your pain and your stiffness weekly if you can. And your CRP, which is your C-reactive protein, which is a level of inflammation in your blood, you want to check that and other relevant blood tests at around 3 months. And you can go private if you're just not getting anywhere with your regular doctor. And then I would measure those roughly annually once things are stable. So in a nutshell, if you have joint pain, get it checked by your doctor first. They will exclude all of the serious things and they will hopefully diagnose you after some investigations. Then you want to accept whatever they recommend because, they are the one that has examined you and are treating you. And, if it was me, I would accept whatever they give me in most cases. But then the point is you want to work on the inflammatory background of that problem, as well as the medication that your doctor gives you. Then hopefully in a few months' time or a few weeks, you can wean off that medication. All of this depends on what your diagnosis is. So this is just general education. None of this is personal medical advice. But I promise you, what you eat and how you move really, really does affect the level of inflammation in your body, and therefore the level of inflammation in your joints and how much your joints hurt. So, I hope I've been clear with this video. I know that I've gone off on a tangent a couple of times. Let me know what you thought of this video. Was it useful? Was it a bit too messy? If you've got any questions, pop them in the comments and I'll try my best to answer them. Thank you so much for watching, and I'll see you next time.